Due to high rates of diabetes, high blood pressure, and heart disease, African Americans have increased risk of developing kidney failure. African Americans suffer from kidney failure at a significantly higher rate than Caucasian, more than 3 times higher, and constitute more than 35% of all patients in the U.S. receiving dialysis for kidney failure. Dr. Joseph Graham is a cardiovascular and thoracic surgeon at Southeastern Cardiovascular Associates, and in conjunction with the Southeast Alabama Medical Center and the Dothan-Eufaula AME churches will bring awareness to these statistics at a health fair to be held on Wednesday, February 21st at Stringer Street AME Church beginning at 6 p.m. Dr. Joseph Graham.
Specific issues with the African American population that are related to an increased incidence of heart and kidney disease, and the percentage of people who have this problem within the African American population, and the studies that have been done on what will help them specifically to not have such a big issue with those problems. Hypertension, kidney disease, and heart disease are very prevalent in the African American population, even though they are a minority. And the whole issue seems to be somewhat related to the diet. It's also related to medications that are specific, that seem to work better for the African American that do not function as well in others. There's a lot of issues but they're primarily diet related, and there are some very interesting studies about changes in diet and the effect. For example, there's been 2 genes identified. There's been a genetic identification of the APOL1 gene, which causes the heart and kidney disease to be more prevalent. There was also a genetic aberration, if you would say, that dates back to the tsetse fly that happened in the African American population, which causes them to have increased amount of kidney disease as a genetic problem. And so it's not well known by a lot of people that is the issue. So that to protect the kidneys is extremely important, and because different medications work differently in that renal problem that's associated with the high blood pressure, that's a very important thing to know. In addition to that, the diabetes, which seems to now be more prevalent in the African American population, and that seems to be related to intestinal receptors that now allow storage of fructose as fat, where it didn't used to happen in that population. So that again is a dietary issue that can be remedied. For people who have hypertension, is the combination of medications that appear to be more advantageous to the African American. Avoiding an ACE inhibitor. ACE inhibitors, which are probably one of the most common antihypertensive drugs, seems to be very detrimental to the renal function of the African American. And for the diabetic, alpha receptor blocker antihypertensive is much more effective than the ACE inhibitor. Those are just things I want to bring up for people who may have that problem and may be able to change their medications by talking to their doctor.
I'm Deborah Pearson reporting for Wolf News.